students, if you're catching this on YouTube at a later date, thank you so much for tuning in wherever you are. I would like to introduce Erin Mays, who's from the class of 2016. She's currently a pharmacist at the University of North Carolina Medical Center, and she's going to take the lead and tell you a little bit about her career and give you guys some really awesome advice. So take it away, Erin.
Great, thank you. So hi everyone, and hopefully you're able to watch this later on. So my name's Erin. As she mentioned, I just graduated from Center in 2016, so about 4 years ago. I'm originally from Louisville, Kentucky, and then went to Center, obviously. And then after Center, I went straight on to pharmacy school at University of North Carolina. So pharmacy nowadays is typically a 4-year program, and you'll complete that after graduating from Center. So for me, kind of thinking of my career path, I pretty much always knew that I wanted to work in some kind of healthcare setting. In high school, I kind of knew that I enjoyed science. I knew that I loved talking to people, and so definitely kind of always saw myself in some kind of healthcare field. But really when kind of getting to Center, and probably about during my sophomore year at Center, I hadn't exactly settled on which specific health profession I wanted to go into. So I was kind of like teetering around with possibly trying to go to med school, maybe thinking about nursing, dentistry was up there at one point, and pharmacy. Those were kind of my options. And so, and I remember it was my sophomore year in the spring, and I was kind of thinking about, all right, well, this summer, after sophomore year, I'd love to hopefully do something that is related to a healthcare profession. The summer after my freshman year, I worked as a camp counselor, which I loved, which was awesome, but I kind of had settled on the fact that, all right, summer after my sophomore year of Center, I want to be doing something that'll help me kind of figure out hopefully which career paths to go into. And so I got a job as a pharmacy technician at CVS that summer. And what's awesome about pharmacy technician job is that, one, it's a paid job. I really wanted something that was going to be paid, not just shadowing. And also, you only have to have a high school degree to be a pharmacy technician. So that was great. I worked in my hometown of Louisville, Kentucky for a summer, and absolutely fell in love with pharmacy. So I worked in a retail setting. And did all the things that a pharmacy technician would do. So I did a lot of filling prescriptions, a lot of talking to patients, a lot of dealing with insurance issues. And I think what I loved most about it is how well respected my pharmacist that I worked with was, and the relationship that he had with his patients was great to see. And so at that point, I'd kind of settled on pharmacy for sure. Something that I personally love about pharmacy is that there are so many different fields that you can practice in once you become a pharmacist. And I think that's something that's definitely more unique to pharmacy compared to other healthcare professions. So I mentioned that I worked at CVS as a pharmacy technician. So that's the retail setting, or the community setting as we call it. But in addition to just working in the community setting, you can work in a variety of other fields. So a big one besides that is hospital, which is actually where I am working in right now. So we consider that more clinical pharmacy. So where you're actually, and I'll talk more about this in a second, but actually as part of the patient healthcare team. So you can be in the hospital or outpatient, maybe in doctor's offices, working directly with the providers and the physicians to make patient care plans for their patients. And so I knew that was an option I wanted to think about. There's also several other fields. There's pharma. So if you want to go work in the pharmaceutical industry, there's lots of jobs for pharmacists there. And then there's also more managed care jobs too. So working for like insurance companies. So that's just like a small list of the different types of jobs that you can have as a pharmacist. But for me, so remember I had that summer at CVS, had settled on pharmacy, and I, still had that one more summer after my junior year where I wanted to kind of hopefully explore another area of pharmacy to just kind of confirm that it's what I wanted to do. And so actually I was able to get set up with the shadowing opportunity at Ephraim McDowell Hospital in downtown Danville, which is a really cool experience. So I went about 3 days a week to Ephraim McDowell and shadowed their technicians, worked as kind of a technician, would spend some time with the pharmacist, would rotate around. And it was really nice. And if anyone's interested in that, it's been a few years, but I still kind of have some contacts there too. So I could hopefully maybe reach out to someone. But so after that was my first introduction to clinical pharmacy. So that's where I really saw the role of a pharmacist in a hospital. And I honestly fell in love with it. And so I kind of at that point pretty much knew that clinical pharmacy is where I wanted to be. But as I mentioned, I applied to pharmacy school during my senior year, during my senior fall. The prerequisites for pharmacy school are very similar to what you'd expect from another healthcare profession. So a lot of chemistry, a lot of biology. Your actual major really does not matter as long as you get all the prerequisites. And so I was actually a biology major and an English minor, was kind of where I landed. But you apply to pharmacy school during your senior year, or you can apply later, but that's what I did. You are required to take a test. So the test for admission is called the PCAT. And so I took that the summer before my senior year of college, and then had a couple interviews during the fall of my senior year. Ended up applying, it's been a while at this point, I think I ended up applying early decision to University of North Carolina Pharmacy School. And so then went straight on there. Had a great time in pharmacy school. It's a 4-year program. What I loved most, and I can talk specifically about UNC, but it's very much a mixed model of time spent in the classroom and time spent in the field actually training with real pharmacists. And so something that a lot of pharmacy schools have is that they kind of force you to spend time in a lot of different pharmacy settings. So I spent 2 months in an independent retail pharmacy in North Carolina. I really enjoyed my time there. And then I also, spent several months in the hospital too. And then your entire last year of pharmacy school was all spent in the field. So we call those your advanced pharmacy practice rotations or your APPEs. It's all split up into month rotations. And so for me, so I just graduated pharmacy school in May, and I am now actually a PGY1 pharmacy resident at the University of North Carolina Hospital. And so kind of in the world of clinical pharmacy, hospital pharmacy residencies are becoming more and more common. And so that's the path that I took. Thinking about kind of what type of pharmacy you want to do. If you want to work in clinical pharmacy and work in a hospital, nowadays doing a pharmacy residency is absolutely the easiest way to get to that goal. It definitely sets you up the best. It's not the only way, but generally, if you are hoping to work in a hospital one day, doing pharmacy residency is the best way to prepare for that. And obviously, I had no idea about any of this until I got into pharmacy school and started at UNC. But what I do now kind of in my day as a pharmacy resident, so as a resident, I still am not specialized yet. And so I am rotating all over the hospital, working in different areas since I'm a general PGY1 resident. So I do a lot of different things. My month's still split up into rotations, but I am kind of all over different specialties. So to give you kind of example, this year so far in August, I was in the inpatient bone marrow transplant unit. So pharmacists are super important in oncology. And so spent a month there. I spent a month in the outpatient gynecologic oncology cancer clinic. So that was really neat too. Worked with patients with ovarian cancer. I spent a month on infectious diseases. So pharmacists are super important there with all of our antibiotics. Coming up, I have a month in the neuro ICU. So we'll be working with a lot of stroke patients. I also staff as a regular clinical pharmacist every third weekend, and then I also work some in our pediatric satellite pharmacy. So there's a ton that you can do even as a clinical pharmacist. Pharmacy residencies are 1 year. Your first year is usually very general, and then many people go on to complete a second year that's more specialized. And so for me, I will be completing my second year actually specializing in oncology. So I'll be doing, hopefully becoming an oncology pharmacist, which is really exciting. Pharmacists are super important there. So kind of overall, I love pharmacy. I'm so glad that I found it kind of in pharmacy or in college and really settled on that as the healthcare profession that I wanted to go into. What I love about it is how much of a unique kind of specialized role we have. And thinking about the other healthcare professions such as medicine, nursing, physical therapy, like our PAs, they generally get anywhere between like 1 to 2 semesters of pharmacology during their training, just because there's so many other things that they are learning about. Pharmacists have the most training on pharmacology compared to any other profession. And so we really do play a special role on the patient care team, having all that kind of that extra knowledge. We're not focused on diagnosing the patient. We can't go in, examine someone, and personally, I did not want to be examining patients, and that was kind of a big reason I wanted to go to pharmacy too. But we play such a big role. Once the provider has made a diagnosis, we then play a big role in deciding how patients can be treated and helping manage their treatment. And so I think it's a super big misconception, and this is something that I kind of tell anyone interested in pharmacy. But if you think about like your typical like hospital and think about the doctors and the people, working to help the patients, you never really think about a pharmacist being right there alongside the patient care team. And I always tell people, if you think about Grey's Anatomy, one of my biggest things with Grey's Anatomy is that they don't show pharmacists as part of the patient care team, which is so false. In any hospital you're going to go to, pharmacists are always right there. We go on rounds with the team. We're verifying all of the orders. Another big misconception is that all orders given by a physician in the hospital have to be verified by a pharmacist. They cannot get to a patient without a pharmacist looking at it first. And so we play a super important role there. So definitely being a big part of the patient care team. We're also really accessible to patients. Even though I don't want to work in a retail pharmacy one day, we depend a lot on our retail colleagues to kind of have those discussions with patients, and I'll be in touch with a lot of the pharmacists where the patients that I see are filling their prescriptions. And so we do a lot of patient counseling too. So even in the hospital, if a patient, comes in with a heart attack, they're going to be started on some new medicines. And so as pharmacists in the hospital, we're the ones who typically provide the patient education to the patients before they go home when started on the new meds. So overall, pharmacy is a fantastic field if you're interested in healthcare. I love it. It's definitely a growing field. I think there's becoming more and more new roles for pharmacists. If you want to work directly with patients, there's a lot of opportunity there. If you like more of the pharmacology side of things, you can go work for pharmaceutical industry and maybe not have to work directly with patients. So you can really adapt the field to wherever your interests kind of lie. And there's definitely no pressure to figure out what type of pharmacy you're interested in until you're, a couple years into pharmacy school. And so I think hopefully that appeals to a lot of people as well. But I'm happy to give my information to the center, and I'm always happy to answer any questions about pharmacy school applications or kind of what's next after getting into pharmacy school. What's pharmacy school like? I'm happy to answer any of those. So hopefully that was helpful. I'm not sure if there's anything else I can kind of talk about.
No, that was fantastic. Okay. That's a really fun fact about Grey's Anatomy. I didn't know that.
Yeah, it's like my biggest thing that I talk to like pre-health students. I'm like, did you know?
I know. It kind of makes me want to write a letter to Shonda Rhimes and be like, you're missing something.
Exactly. Yeah, wow. There's so much we can do. We're actually gearing up right now so pharmacists can give vaccinations. You can go to CVS, get your flu shot. I'm like in training right now to start giving COVID vaccines. So
wow.
that'll be really cool too. Who would have thought kind of as a pharmacist that we'd be helping out with that. But
wow. Yeah. What an integral time to be like learning.
Right? I know.
Yeah.
Pharmacist.
Yeah.
For sure.
Well, I guess I have a question that I think maybe some of the students might know, and it's one of my favorite questions to ask. Yeah. What is your favorite part about being a pharmacist or being in this career?
Yeah. So I think there's a couple things. One is absolutely, I think, at the end of the day, like helping patients. Even more in the past 10, 15 years, there are new drugs coming on the market every single day, much more than there were, 20, 30 years ago. And so with all of the new medications coming out, it is impossible for non-pharmacists to keep up with all of that. It's even tough for pharmacists, but I think we play such a unique integral role of the patient care team. And we can help patients kind of with any of their medication needs. We're always checking for drug interactions in the hospital or even outside the hospital in the community setting. With more and more drugs coming out, we need someone who's kind of an expert on those medicines. And so I think it's really fun to kind of show our worth and show how much we know and see, how we can help patients and then help make their physicians and providers happy too.
Cool. Well, I have just one last question. Do you have any advice for students who are at Center right now who are maybe thinking about going into this career field and kind of
absolutely
whenever you were in their position, what do you wish that you would have been told?
Yeah, so I think it was tough for me early on coming into Center. You think you want to go into healthcare, you automatically usually think physician. I want to go to med school. And I think I did not get a kind of enough exposure early on to some of the other healthcare fields. I really just was able to kind of fall into pharmacy just by getting that one summer job as a technician. So I say absolutely do your research when it comes to looking at all the healthcare professions. Even physician's assistants are becoming more and more popular, and NPs. And so there's a lot of paths to become, a really important member of a healthcare team besides just going to med school. And so I'd encourage people to do their research and also to seek out anyone kind of practicing in those fields, and hopefully look to shadow them as well. Shadowing is going to be tough, I'm sure, in this day and age, but hopefully it'll be back to kind of normal this summer. And definitely I'd say let's just like keep your mind open, because you never know like what's going to be the best path for you until you kind of are exposed to it.
That's awesome. I
Mhm.
really appreciate this, Erin. Thank
Yeah,
you.
I hope it was
And I
helpful.
know that students are really going to benefit from this.
Yeah, absolutely. Feel free. I mean, I don't know if you have my email, but I'm happy to like give my
Yeah,
email to anyone who's interested. So
great.
they can
Okay,
reach
well,
out.
yeah, we'll make sure and add that little bit underneath of YouTube and tell them to reach out to us, and we'd be happy to connect you with any students that have questions. So,
Awesome.
yeah,
Yay, thank
well, thank
you.
you. Happy holidays.
You too. Bye.
Bye.